Croup or Laryngotracheobronchitis is the topic for this video. So let's get started. Croup is basically an inflammatory process. It involves the inflammation of the respiratory tracts, both the upper and lower, and it's most commonly caused by viruses, and those viruses are parainfluenza. Parainfluenza is by far the most common, and it's type 1, but there are several others that could cause croup, including respiratory syncytial virus and the influenza viruses, influenza A and B. Now, this croup is basically an inflammation of the larynx, trachea, and the bronchioles, including all the way down to the lung. And let me show you a little diagram that sort of illustrates that. So here we are. This is the larynx, and this is the trachea, and this is a healthy airway right here. As you can see, it's very patent. But then this is croup. Now notice the swollen tissue here. What it's doing, it's narrowing the airway, and that narrowing is what leads to the symptomatology of croup. You can clearly see that there. So what are the symptoms? What are the symptoms that can occur? Well, that swelling that I just showed you and the inflammation in that subglottic region can lead to the following symptoms. And some of these are pretty classic. You've got this barking cough, almost that sounds like a seal. That's commonly described. You have something called stridor. Stridor. What is stridor? Well, stridor basically is a high-pitched wheezing sound resultant from the turbulent airflow in that airway that's been narrowed. And I wanted to play for you the stridor so you can get an idea of what it sounds like. So let's see if this... So that's what stridor sounds like. Now that sound is happening because the airway is narrowed and or obstructed, and that high-pitched wheezing sound results when a child breathes, basically. Now, these symptoms most often happen at night, and another thing that's important is a child can often show retractions. Now, retractions are these where the sternal area starts to draw inward. These sternal indrawings, and I'll show you a picture of a child with those sternal indrawings. Right here, if you can see the middle part there, do you see how that kind of caves in? And that's what we mean by those retractions. Okay, so now let's go talk a little bit about the symptoms. Not the symptoms, the diagnosis. Symptoms we just talked about. Alright, so diagnosis. How do you diagnose this? The child comes in and he or she has got these symptoms. And just before I get into the diagnosis, fever can occur about 50% of the time. So I just wanted to quickly mention that. Okay, so how do we diagnose croup? Well, other than the symptoms that are pretty classic, like the barking cough and the inspiratory stridor that I played a recording for you, you do x-rays of the neck. And when you do the x-rays of the neck, you can actually see that airway narrowing. You remember that airway narrowing that occurs? Well, you can actually see that. And that actually has a special name given to it. It's called steeple sign. I'm assuming because a steeple is, looks like that. And let me show you a chest x-ray. No, sorry, not a chest x-ray, a neck x-ray. And this is the steeple sign. If you can kind of see, it's got that triangular shape. And that's directly the result of this type of narrowing of the airway. So that's pretty classic. Other things that you can do in part of the diagnostic workup of croup are put a pulse ox on the child to monitor their oxygen saturation, arterial blood gases are important, because what happens after a while is the child can get tired, and the child can eventually, if serious enough, develop hypercapnia. And hypercapnia essentially is when the CO2 levels rise, and that needs to be measured. So CO2 levels need to be measured if the child's condition worsens. And we'll throw in a temperature in there. Doesn't hurt. Alright, so it's a pretty straightforward symptomatology and diagnostic workup. So then how do you treat it? Well, you've diagnosed it, how do you treat it? Well, I want to break up the treatment into 3 parts. The first part is really referring to just an outpatient type of treatment, mild case of croup. The next part is inpatient, and then the third is the severe. I'll talk a little bit about each. Well, the basics of outpatient is really just, bringing down the fever with an antipyretic. In children, most commonly, I'll give an ibuprofen or acetaminophen. Keep the child hydration. But outpatient can also involve something that is used known as humidified air. Now, what's this all about? What's humidified air? Well, humidified air is can ameliorate the upper airway drying, and that's the main reason these vaporizers or humidifiers are used, to prevent the upper airways from drying out. And then oral corticosteroids. Oral corticosteroids. Now remember, the basic fundamental definition of croup or laryngotracheobronchitis is that it's an inflammation, so the steroids decrease that inflammation, plain and simple. Now let's get into the inpatient treatment. The child's been hospitalized and you want to treat the child. How would you do that? Well, interestingly, 2 of these are the same. You also give humidified oxygen in the hospital, and you also give steroids for the same reasons that I talked about earlier. But another thing that's given in the hospital is something called racemic epinephrine. Epinephrine. What this acts as is a bronchodilator. And this bronchodilator is given in a nebulized form, and can definitely offer symptomatic relief, and also relieve the fatigue that children can develop when they have to work so hard to breathe during an infection. Now, in the severe cases, most severe cases, where the child has increasing respiratory distress, fatigue, that I talked about, you really need to make sure that you check the CO2 levels. And if the CO2 level, the arterial CO2 level, is greater than 45, then that means the child is indeed getting very tired and just having a very difficult time expelling the CO2. So they need intubation, endotracheal intubation. And that will give the child a break, basically, and allow the child to get their ABGs, arterial blood gases, down to normal. And one final thing I'd like to mention is antibiotics. Do you use them or do you not use them? Yes or no? Well, viruses are the most common cause of croup, so you don't really need to use an antibiotic. So the answer is no. Antibiotics are rarely used in croup. I just want to finish off the presentation or video with a small vignette. Here we go. 3-year-old boy is brought to the emergency room by his parents in the late evening. He has developed a sudden onset of seal-like barky cough accompanied by clear nasal discharge. His parents became alarmed when he developed stridor, which persists throughout the trip to the hospital. On examination, he has a seal-like barky cough, and inspiratory stridor when at rest, which worsens with agitation. Persistent sternal indrawing are also evident at rest. Well, it helps to have a picture of those indrawings right next to you. Well, this is obviously a clinical vignette describing croup.